Thank you everybody for being here this afternoon. With me today are Secretary Landgraf, Colonel Setting, Fred Calhoun from the state FOP, Dave Humes, Rebecca King, and Don Keister from Attack Addiction, and you'll hear from all of them in roughly that order to the extent that we can remember going forward, and I appreciate all of them being here today as well. We're here today because, notwithstanding some extraordinary effort and hard work by many people in our state, far too many Delawareans are dying from prescription drug and heroin overdoses. The catalysts behind many of the state's efforts in the last several years to deal with substance use disorder have been the family members of Delawareans who suffered from drug overdoses, some of whom did not survive. And some of those family members, as I mentioned, are here today. And their courage and determination is inspirational, and we owe it to them and to other families who have lost loved ones to redouble our efforts. The statistics tell part of the story. In 2013, the state's Prescription Drug Advisory Committee found that Delaware had the nation's 9th highest drug overdose rate. There were 79 deaths from prescription opioid overdoses in 2013, another 23 deaths from heroin overdoses. That's 2 Delawareans a week just from those drugs, and that's just the reported deaths. The heroin overdose death number almost tripled in the 4-year period between 2009 and 2013. Side by side with those overdose numbers is Delaware's high rate of opioid prescriptions and misuse of opioid prescriptions. The Prescription Drug Advisory Committee reported that Delaware had America's 5th highest rate of opioid sales per capita and a significantly higher percentage of its residents engaging in non-medical use of prescription opioids than the national average number. Earlier this year, the state's Division of Public Health reported that Delaware's medical providers ranked highest in the country in high-dose opioid relievers prescribed per capita, and second highest in the country in long-acting and extended relief opioid pain relievers per capita. Why do we discuss heroin and prescription opioids together? Because their misuse is closely intertwined. The United States Centers for Disease Control and Prevention reported just last month that most heroin users have a history of non-medical use of prescription opioid pain relievers. So those are the numbers. But behind those numbers are real people, like Tyler Keister, like Gregory Humes, like John Perkins. And as if that weren't enough, the harm from the use and trafficking of drugs extends far beyond the actual victims and their families. I can tell you from my first 7 months in this job that many of the homicides for which we have suspects involve the sale or purchase or theft of drugs. And I know that Colonel Setting has spoken frequently about the impact of drug use on property crime in our state as well. So we're all here today to talk about some additional steps that we need to start taking to further address this epidemic. And there are 4 that we want to talk about specifically, and I'll try to run through them quickly. They're laid out in a lot more detail in a document that we have to pass out to you. First, we believe that the state needs to tighten its regulations regarding the prescription of opiate drugs. People who need prescription opiate drugs should have them, and those ultimate decisions should be made by doctors and patients in consultation with one another. But we don't believe that the state's regulations, as currently written, require enough due diligence before opiate drugs are prescribed in some cases, and we don't believe that they require enough monitoring of patients when opiate drugs are prescribed for extended periods of time. So we have recommended changes in draft regulations that are being considered by the state's Controlled Substances Advisory Committee that would require increased use of the state's prescription monitoring system before drugs are prescribed, increased use of urine drug screens for long-term users of prescription opiates, and consultation in all cases between a doctor and patient before opiates are prescribed in the first place. These changes would ensure that patients who need prescription opiates get them, but that patients know the risks and alternatives. And these changes would also allow doctors to ensure that patients are good candidates for prescription opiates before prescribing them, and that the drugs are not being misused or diverted once they have been prescribed. Second, we are planning to work with the state's medical community over the next 5 months to propose legislation to the General Assembly that will cause an independent review to take place of the case of each Delawarean who dies from a prescription drug or heroin overdose. This is something that the state does now in all child death cases. And in those child death cases, that review process has been an outstanding tool to point out structural problems that could be addressed to prevent future tragedies. So our goal with prescription drug and heroin overdose cases is the same. by examining the medical records and facts in cases where overdose deaths occur, that we would be able to determine other steps that we could take to prevent future tragedies. We look forward to working with the medical community and advocates over the next 5 months and presenting the bill to the General Assembly when it returns in January. Third, we will continue to advocate, as we have for the last 7 months, for the state to expand the availability of treatment opportunities for Delawareans with substance use disorder. And Secretary Landgraf has been an advocate for this as well. But despite her efforts, there are still not a sufficient number of treatment slots today for Delawareans who are seeking treatment. Beyond that, we plan to bring together medical leaders, advocates, and treatment professionals to determine how Delaware can heed the strong advice of the CDC last month to pursue evidence-based substance abuse treatment, including medication-assisted treatment for opioid use disorders. There are multiple forms of medication-assisted treatment for opioid use disorders, which can be an important part of an individualized recovery plan that includes continuous counseling with the goal of reducing dosages as part of successful treatment. The goal of convening this group will be to develop Delaware-based best practices for the use of medication and treatment of substance use disorder, so that any limitations imposed on its use can be based on sound medical and treatment principles, and as many Delawareans as possible who might benefit from its responsible use can have access to it. Our goal is to come up with such practices by early next year. Finally, we want to make it possible for first responders in Delaware, all first responders in Delaware, to follow the great examples set by the Newcastle County, Ocean View, and Middletown police departments in carrying naloxone, which the CDC has called the treatment of choice for reversing the effects of heroin and opioid overdoses. And again, I have to recognize the efforts of the attack addiction representatives who are here today. This is a cause that they brought to Delaware. The General Assembly has already passed legislation permitting police officers, after proper training, to carry and administer naloxone. And this is an example of one of the packages that they carry right now. And the Newcastle County and Middletown police officers have actually been using this in the field to save overdose victims. The Department of Justice's work in this area is going to be concentrated in 2 areas. First, trying to address any logistical or legal concerns that may be preventing other departments from having their officers carry naloxone. And second, trying to make it more affordable. Earlier this week, we sent a letter to the manufacturer of the brand of naloxone that's used by Delaware first responders, asking for a rebate for government agencies and volunteer fire companies who purchase it. And we're hopeful that we're going to get a favorable response from the company and be able to reduce the financial burden involved in having police officers and EMTs in Delaware carry it. So again, I want to thank all of our partners who are here today, but particularly the family members who have overcome personal tragedies and dedicated themselves to making sure that other families do not lose loved ones. A lot of good work has been done in this area over the last several years, some of it by people in this room, but we have a long way to go, and we at the Delaware Department of Justice are determined to be active participants in that work. And I would like to turn things over now to one of the people who has been one of the staunchest advocates to improve in this area, which is Secretary Rita Landgraf. Secretary Landgraf.
Thank you, Attorney General Denn. I would also like to extend my greatest appreciation to Newcastle County and to the State Fraternal Office of Police for their commitment to combating the terrible addiction epidemic we have here in Delaware. And I would like to extend a very warm welcome and a personal thank you to the attack addiction family, inclusive of the Keisters, the Humes, and Becky, hundreds of others who have been with us every step of the way as we look to combat opiate and heroin addiction in Delaware. A few years ago, Governor Jack Markell sent a clear message. It's time for all hands on deck. Too many people, too many families, too many lives were being torn apart by this disease of addiction. He asked that I be point on advancing an agenda that addresses this epidemic with an increased focus on prevention and education outreach, law enforcement and criminal justice strategies, and enhanced treatment and recovery. And as the Attorney General said, we have made progress. There are new partnerships, new laws, new funding, and new programs. as we start to turn this tide, but it is still not enough. Sadly, we are fighting a disease of epidemic proportion, and this disease is destroying and is taking lives. But we also know that we can prevent disease, inclusive of addiction, and the strategies presented here today support that level of prevention. We know that treatment works and that recovery is possible. We have thousands of Delawareans that are successful examples of the power of recovery. So what is happening in Delaware to promote the healing side of the addiction epidemic? Delaware is significantly increasing the public treatment and recovery slots. When someone is ready for treatment, they should not be told there is not a bed or there is no support available. Our commitment and the commitment of our providers is to take the necessary steps to connect people to treatment and to enhance the varied levels of care that people need. We are increasing withdrawal management services statewide with a new detox clinic to serve both Kent and Sussex counties. We are doubling residential treatment and sober living beds for teens and adults and opening new programs statewide. Working closely with our friends at Attack Addiction and under their leadership and guidance, the Delaware now has a law, the Good Samaritan law, so that anyone calling 911 to report an overdose will be exempt from prosecution. And Delaware not only allows, but vigorously supports and has provided funds to support individual and emergency responder use of naloxone, also known as Narcan, to interrupt a drug overdose in progress and give someone a fighting chance to benefit from medical care. We understand there have been 7 saves in Newcastle County, I believe since May, 1 in Middletown and 1 in Ocean View since the spring, from the law enforcement outreach. But we also know with the community education and outreach, many more lives most likely have been saved and will be saved because of this hands-on support. Of course, we also want to get upstream and have significantly increased our prevention services and messaging, including the Help Is Here website and Drinking Hurts Thinking campaign, which seeks to educate, inspire, and inform Delawareans about the dangers of substance abuse, paths to treatment, and crisis intervention resources. The Attorney General talked about the Prescription Drug Action Committee, which is co-chaired by our Department of Health and Social Services, Division of Public Health Director, Dr. Carol Rita, and Dr. Calhoun, past president of the Medical Society of Delaware. This committee, known as PDAC, has worked closely with community partners, law enforcement, physicians, advocates, and more closely to the pipeline relative to the access to prescription medications, increasing medical provider education requirements for those prescribing certain prescription medications, and much more needs to be done, as the Attorney General has noted. I would also like to commend the Department of State for their role to monitor, regulate, and reduce the number of illicit prescription drugs here in Delaware. I would like to thank the Attorney General for his commitment to this issue, and I look forward to working with him on these proposals. As I noted in the beginning, this truly and remains an all-hands-on-deck approach, and as the Chief Public Health Officer, I am so deeply grateful for the response of all relative to the solution-oriented approaches in addressing this horrific disease of addiction. Finally, for those of us who have lived with addiction, seen it firsthand in our families and our friends, in our co-workers and in our colleagues, there is something that cannot be forgotten about this terrible disease. These are people, real people, mothers, fathers, sisters, brothers, grandparents, and friends. This disease does not discriminate. All are fair game at any age, any culture, any gender, any race, religion, and so on. As my department was designing the Help Is Here campaign to link people to resources and crisis services, the advocates, people like Dave and his wife, said this: your ads, your outreach, your website must include that message of hope, a message of recovery, a message of everyday people regaining their lives. Thank you, Attorney General Den, for your commitment in this fight against the disease of addiction. We brought handouts for you all. We hope you will take them. We brought bracelets that talk about prevention matters with our helpisherede.com logo. As the Attorney General has indicated, law enforcement carries the naloxone like this. The community received naloxone in this packet after they had training. You're welcome to look at this. I'll leave mine here. We also have Help Is Here cards that we will leave in the back for you that do have toll-free numbers that you can call for individuals who are in crisis. Thank you so much, Attorney General.
Thank you, Secretary Landgraf, for not only for being here today, but for your long-standing and really passionate commitment to this issue. I would like to turn things over to Colonel Setting, and as I mentioned, the Newcastle County Police are among the 3 departments that have really been in the forefront of having this medication out in the field, and I think that they have some good success stories to tell about it.
Thank you, Attorney General Den, for having me, and certainly, Secretary, thank you so much. It is a very interesting position for a police chief to announce that the folks that are addicted to heroin aren't necessarily criminals, they are certainly victims. And when I first said this 3 years ago, I was the odd man out. Well, people pour out of the woodwork to tell you their stories. The survivors will tell you that their children were not criminals, that they were hopelessly addicted, and that there was very little help available. And I know our officers, about 26 of them are carrying the Narcan, and we have had 7 saves in Newcastle County alone. I'm very proud of that. What I'm more proud of is to see community leaders, such as our Attorney General and the Secretary, up here talking about a unified front. This is not a police problem. We have done the police part of it. We have filled the evidence lockers. We have record seizures of heroin. We have arrested the dealers, and in some cases the big dealers from out of state that are bringing the drug in. The prisons are full. The evidence lockers are full. The great experiment is a failure. These people need help, and I am so glad that I'm not the only person saying it any longer. There are very, very powerful people, including our governor, our county executive, Tom Gordon, who set aside $500,000 for educating the next generation. And that's the answer. Communication like this. We're willing to talk about DUI. We're willing to talk about the importance of sunscreen, but nobody wants to talk about heroin, and it's killing family members, friends, and loved ones every day. And I'm so grateful to see our leaders up here saying we're going in a different direction. This is not just a police problem. We obviously are willing to do anything and everything we can to see less of these victims lost to this drug and hope that they find rehabilitation. But more importantly, there has to be help out there. Thank you so much.
Thank you. Thank you.
Delaware was one of the first states to authorize first responders and law enforcement officers to carry Narcan, and the state FOP was a big part of making sure that that happened, and I'm appreciative of Fred Calhoun, who's the head of the state FOP, for being here today.
Thank you. Thank you. Attorney General Den, I'd like to thank you for inviting me here today and for placing such a high priority on helping those with the disease known as drug addiction. In our profession, it takes 2 qualities to be a successful leader, to have a successful police department. You need to be a visionary, and you need to be committed. The chiefs of the 3 agencies had both a vision and are committed. They both realized the impact heroin was having on our youth, families, and society in general, and their vision was to provide those suffering from drug addiction and their families every opportunity to escape the grasp of this horrible disease. And the FOP believes that the development of the Narcan kits and the use by the officers is going to have a very large impact in the long term on that. I believe their commitment speaks for itself. They've had to work with local law departments, community groups, and their officers to ensure protocols are followed and that everyone has received the proper training to be able to handle the situation, to be able to administer the drug, and to be able to secure the safety of the individual after the drug takes effect. During the last General Assembly, I testified on behalf of legislation that would provide Narcan kits to law enforcement officers in the field. I did this for two reasons: the impact it will have on the families and the impact it will have on the officers. You have to understand that the officers that I represent, none of them want to be standing in the doorway when a family member or a child walks up from the sidewalk, looking into their eyes, knowing that the next thing you're going to tell them will impact them for the rest of their lives. No officer wants to ever have to do that. We believe that the use of these kits will help us end that. We believe that this program will offer them a second chance at a new life, a second chance to regain connection with their families. That's what we're hoping we get from this. With that being said, I once again would like to commend everyone for having a part in legislation and helping us get this done. Attorney General Den, thank you very much.
Thanks, Fred. Several folks who have been up here have mentioned the Attack Addiction Group, and a lot of the initiatives that I mentioned as having made progress in Delaware, were started by them and wouldn't have moved forward without them. It's that simple. So I wanted to make sure they were our cleanup hitters today. As I told them, I don't know who was going to go first. Dave, coming up.
My name is Don Keister. I'm a board member of Attack Addiction. And I want to thank Attorney General Matt Denn for his efforts to understand and react to what is the largest health problem in our state, and his confidence in Attack Addiction. Also to Secretary Landgraf for all the work that she does in supporting this issue around substance abuse disorder. Matt Denn has produced a comprehensive plan to address the related problems of opiate drug abuse and heroin abuse on separate fronts. He's considered input from a variety of sources, and I would like to see this plan put into practice. Different members of our group will speak about each individual segment of the plan. I will speak about the regulations governing the prescription of opiates. This is more important than most people realize, as the treating of pain with opiates has led to an increased use of heroin. A recent study from the Centers of Disease Control and Prevention found that a person was 40 times more likely to be a heroin abuser if he had previously abused pain-killing drugs. 80% of new heroin users have previously used opiate drugs. Delaware is the nation's 5th highest overall rate of opiate sales. As we distribute pain-killing medication, we are also fueling the possibility of addiction that will lead to heroin use. I cannot tell you the number of people that come to our meetings that acquired their addiction following an automobile accident, knee replacement, back operation, wisdom teeth removed, or some other athletic injury. Acute pain is essentially time limited and must be handled appropriately by medical personnel, family members, and those suffering from trauma or disease. When doctors prescribe opiates as pain medication, it is like giving patients a loaded gun that must be handled properly so that death by the disease of addiction does not occur. It is my opinion that small amounts must be handed out and patients must be followed to make sure that they are not receiving a large number of painkillers through multiple prescriptions. Counseling must be continual as to the dangers of prescribed pain medication. Understanding of family history must also take place to realize the hereditary possibilities to become addiction. Matt Denn's position paper describes specific guidelines for prescribing drugs and managing pain. With proper legislation and doctor buy-in, to include training, we can begin to control the number of pills being prescribed. As patients become dependent on opiates and they can no longer obtain prescriptions, they soon turn to heroin, which is cheaper and easier to obtain. According to the CDC, deaths from heroin-related overdose have nearly quadrupled between 2002 and 2013. Our control of the distribution of opiate pain relievers must be accompanied with sound medical supervision, responsible oversight so that patients recover from their pain issues without the burden of addiction. One last note. As our sufferers from pain receive larger number of pills, even if they do not become addicted, these opiates often fall into the hands of our middle and high school students who take them to parties. After the parties are over and the pills are gone, these young adults turn to heroin. And many of these young people, along with their families, are affected for life. Our son followed this path and at age 24 died from a heroin overdose. Please, let's do everything we can to stop the pain.
Hi, good afternoon. My name is Becky King, and I'm a board member of Attack Addiction, and I'm also a school nurse, and I'm also the mother of a daughter in long-term recovery. My daughter is not a bad person who is trying to get good. She is a sick person who is trying to get well. Thank you for allowing us to be here today to provide public comment. I want to thank you for the recommendations to conduct formal reviews of deaths caused by prescription opiates and heroin. The Child Death, Near Death, and Stillbirth Commission currently provides information on where and why children 18 and under die and which deaths might have been prevented. We know that we are in the top 10 states having the highest drug overdose rate. It is very alarming, and like Rita Landgraf said, we are in the midst of an epidemic. In the United States, every 12 minutes there is a death from overdose. In the hour that we are all here together today, 6 people will die. Therefore, a comprehensive, multidisciplinary review of deaths from prescription opiates and heroin is greatly needed given our overdose statistics along with the national ones. This review will give us vital information where and why Delawareans die from overdose and give us better understanding of the causes surrounding these untimely deaths. This information will provide the Governor and our General Assembly with recommendations to improve conditions to impact mortality and increase chances for recovery. Subsequently, this data can identify areas of prevention and what resources are needed for the community. Attack Addiction strongly supports drafting legislation that will have deaths from prescription drugs and heroin reviewed in the same manner as the current child death review legislation. I'd also like to take this opportunity today to thank Public Health and the Department of Education. I don't know if you know this or not, but on Tuesday, August 4th, Delaware high school nurses were giving standing orders for the use of naloxone and were equipped with Evzio auto-injectors. So when we go back to school in just a few short weeks, all high school nurses in Delaware will have this. In June, the National Association of School Nurses issued a national policy statement on naloxone use in the school setting. School nurses are primary prevention agents in schools. They help families recognize signs and symptoms of substance abuse, guide them to resources, and assist them in making referrals for treatment. School nurses are also on the front lines as emergency responders for allergic reactions, asthma attacks, and diabetic emergencies. These important measures our state has embraced now also provide Delaware school nurses the opportunity to save potential overdose victims in the school setting. This effort has made Delaware a model for other states to follow. Attack Addiction is very grateful for your support in this area, and we are proud to join the Newcastle County Police as a group of first responders carrying naloxone. Thank you.
Good afternoon. My name is Dave Humes. I'm also a board member of Attack Addiction. I'd also like to thank Attorney General Denn for having us here today and all the cooperation and support we've got from Secretary Landgraf along the way. I'm also a person in long-term recovery, having been in recovery since October of 1987. And I also support the Attorney General's efforts for medicine-assisted treatment, or MAT. One of the things I've learned on my journey is I can boil down to you do anything that you can legally do to maintain your sobriety. Fortunately, I've never had any bouts with heroin. I've done about everything other than that. But working with the IOP groups from the drug diversion courts, we find that these young people with heroin addictions have an addiction that I can't even begin to comprehend because it's just so strong. And each recovery plan for this addiction is different from person to person. It's not a cookie cutter model. So if somebody needs one sort of medication over another to get well, they should have that. The goal, of course, is at some point in time to be able to get off of that medication. So I did want to touch a little bit on the MAT. And I also wanted to talk about the police officers here in Delaware. I'd like to thank Chief McLaughlin of Ocean View Department. I'd like to thank Colonel Setting of the Newcastle County Police Department. I'd also like to thank Captain Kroll of the Newcastle County Police Department, who's been a great liaison and has invited us to training to make comment on their training methods, and he's been very supportive as well. And I'd like to thank Jason Faulkner, who's a councilman in Middletown, who has also worked with the police there. With the 3 departments that have been trained here in Delaware, within a very short time after they've been trained, they've saved a life. By short time, I'm talking less than a month, and it's probably each of those departments has saved a life in less than 2 weeks of having been trained. So we have 3 departments, and obviously the goal is to have more of those departments become trained. TAC Addiction has been meeting with the Delaware State Police, the Delaware Council of Police Chiefs, and some individual police chiefs along the way to try and overcome perceived barriers to their carrying, and we think we've done a good job of addressing this. We've also had discussions with Division Director Diane Hainsworth of the OEMS, and she says that we can do some things to expedite the training where necessary. So we're also working there to get the departments trained. As an incentive, we've also received a donation to the state of Delaware of what was mentioned before, Evzio. It's an auto-injector. It talks to you and tells you how to do it. There's been 350 doses of those that have been set aside for any departments of police officers that wish to be trained. It's going to be on a first-come, first-served basis. I'd like to just end up very briefly with a story. On May 19th, I received an email from Captain Crowell of the Newcastle County Police. And he said, Dave, I just wanted to inform you that the Newcastle County Police have just made their first save with naloxone. I replied immediately to him. I said, you won't believe how poignant your email is today. I have literally walked in the door from visiting my son Greg's gravesite on the 3rd anniversary of his death. You have made today immeasurably better. Thank you very much.
Thank you very much. We are done with the formal part of this, but we're all, I think, hopefully we can all stick around. If anyone wants to talk to any of the folks who are here individually, we're happy to do that. Thank you for being here.